Going to the doctors can be really intimidating. I am guilty of putting off appointments for years, not months, years. Yes, I'm busy, as all moms are, and that has something to do with it, but it's also the fact that they're kind of intimidating. I thought it would be very helpful to ask a few of these doctors, what do you wish your patients knew? Here's what they had to say.
Your relationship with your provider can be so much better. Number one, the right fit increases efficacy and efficiency. Ask for a meet and greet, check social media, or website bios. 2, bring a list so you can prioritize which items are critical for this visit together with your provider. 3, call ahead, make sure they know what your chief goal is for this visit and you know how long your appointment's going to be. 4, be honest. Tell your provider about your supplements, other providers, and challenges critical to making the most effective health plan for you. 5, navigate the conversation. Ask up front, I need listening today, or advice, or intervention. 6, give constructive feedback. Your providers only ever get better if they know that you found healing, or you're not yet well, or if you have found healing from someone else.
Something that I wish my patients knew is that pregnancy and delivery can be treated as an orthopedic injury. Unlike ankle sprains and low back pain that typically get referred for care, pregnancy is something that women are expected to be able to rehabilitate on their own unless there's a traumatic delivery or some sort of complication. But if you think about the postural changes, the ligament changes, the structural changes, and the muscle damage that occurs during pregnancy and delivery, standard outpatient care is something that should be sought regardless of trauma or complication during delivery. My hope is to encourage women to seek care postpartum as a standard part of their postnatal care. I hope to encourage women to seek physical therapist advice in order to reactivate their muscles and reclaim their body after giving birth.
I wish you knew and could take to heart that self-care isn't selfish. So many women wait far too long to seek medical care, and they've really been suffering for years before they finally take some time for themselves. The best diet and lifestyle advice, the most complicated cutting-edge test, the most advanced nutraceutical protocol, none of that can be optimally helpful with a patient that isn't able to set boundaries for self-care at work and at home. So I invite you to create some space for yourself, to step forward, look at your calendar, and find one thing that you can say no to or you can delegate. If you could claim back 30 minutes a day to take care of yourself, imagine how your health would change. The world is a pretty stressful place, especially now. Your body and your mind deserve some rest that's restorative. So let's reimagine what's possible for women's health and start by stepping forward and creating some space for yourself and your own self-care.